brought to you by a between Oklahoma Human Services, University of Oklahoma Ann and Henry Zero School of Social Work, and the Oklahoma Adoption Competency Network. We appreciate everyone joining during your lunch or noon hour. We want to get started so we can make sure to respect everyone's time and the great information being discussed today. First, let us go over a few housekeeping things for our time together this afternoon. We are recording this meeting, so by participating, you're giving your consent to be recorded. Please help us reduce distractions so we can all focus and participate. We have muted everyone to make it possible for everyone to hear the speakers. We want you to express your thoughts and questions, so please utilize the chat for this purpose. We will monitor the chat and questions will be touched upon during our Q&A time in the last 15 minutes of the webinar. We want to see you, so if you are willing and able, please turn on your video. If not, that is fine also. To receive information about other post-adoption events, please list your name and email in the chat, and we will make sure to add you to our contact list. Please remember confidentiality. It is vital that we protect confidential information, so we will not be sharing specifics like names or details about adoption cases, people, or children. If you are a foster parent attending this training, you will receive 1 hour of training credit towards the 12 hours of in-service training that you need each year. These trainings are not yet available as CEU credits for professionals. However, you may submit the certificate to your agency and request training credit for your agency's policies. Please indicate in the chat if you would like to receive a certificate of attendance and participation by putting your name and email. Now I'm going to hand this off to Lacey Sorrell. She's one of our clinical workers and today's host. She's going to be discussing some different types of therapy with us.
Hello, everyone. I'm going to go ahead and start sharing my screen. Thanks for hanging in there with us. We had a few technical difficulties at the beginning. So like Carly said, we are going to be talking about a few different types of therapy today. And we're just going to talk about some of the different aspects of the different types of therapy, how to choose which one may be best for you or best for your kiddos. And so we're just going to work through each of these different types. And also, like Carly said, I am going to go ahead and do a Q&A time at the end. However, if there's anything that you have questions about or want to comment on prior to that, feel free to interrupt me. Use the little raise your hand feature or just unmute and go ahead and ask your question. Using the chat box is also fine, and I'll kind of check that occasionally. So I am Lacey Sorrells. I'm one of the clinical team members in post-adoption. So some of the most commonly seen or used types of therapy, and this is not for like the general population. This is really specific to like our population, foster and adoptive communities. So play therapy is the first one. So some of the goals of play therapy are working on communication and expressing feelings, modifying behavior, developing problem-solving skills, and expressing feelings through play versus expecting kiddos to always be able to find the right words to express what they're feeling or experiencing. Some of the key aspects of play therapy is that it is child-led, and that means basically the child's behavior is observed by the therapist while they're allowed the space to just practice their play and pretending. Some of the diagnoses or conditions that this addresses are chronic illness or palliative care, developmental delays, emotional or behavioral problems, ADHD, conduct disorders, and then it can just be used for general trauma as well. Some of the details about play therapy: the sessions typically last between 30 and 50 minutes, and they're typically weekly for an average of about 20 sessions. And this, along with pretty much all of the others that we're going to talk about, can be tailored to each individual. So they may go less, they may go more, but this is kind of the general average. Play therapy was also created for ages 3 to 12, and it has been adapted for older kids and adults for situations like those with cognitive impairment. And one of the things I didn't mention up in the general therapy section, or what this therapy includes, is there's generally 4 rules that are a part of the room or the experience of the therapy session. And those are: no one gets hurt, nothing gets intentionally broken, all toys must stay in the room, and then all feelings are okay. Outside of those 4 rules, pretty much anything play-wise is allowed. The next type we're going to talk about is theraplay. So theraplay is different than play therapy, but because of such a similar name, they often get confused. So the goals of TheraPlay are to strengthen attachment and build relationships. That's kind of the primary overarching goal. And this is done by building trust and connection and then creating moments of joy and laughter within whoever's participating in the session. Some common diagnoses we see that attend TheraPlay are ADHD, ODD, PTSD, and RAD. And a TheraPlay session includes a few different things. So first, they do what is called a MIM assessment or a Marshak interaction method. And basically, that is just an observation of, we're going to use the example of parent and child in this situation. It's an observation of the parent and child completing a set of 8 to 10 structured activities. And they're looking at things like who's the leader? Is the parent taking charge? Is the kid taking charge? How do they interact with each other? How are they able to find that enjoyment with each other? So it kind of assesses all of those areas through observation, and that kind of leads the way to help develop the treatment plan or what things might need to be worked on. This is different from play therapy in that this is very much adult-led. You're really working to establish that confident leader. And some of the ways that this happens is, say you have a parent that maybe isn't very good at play or isn't very good at doing silly activities. This may start out with the therapist practicing those activities with the parent to kind of teach them how they go or modeling for them how they should interact with their kiddo. It then may transition to the therapist modeling those activities with the child. And eventually the goal is that parent taking over those particular activities with the child, again, to establish that confident leader role with the parent or caregiver. So these are typically 30-minute to hour-long sessions, and it typically lasts between 10 and 20 sessions. And this is used with all ages, but it is primarily used with children and their caregivers. And that's children of all ages, old enough, toddlers all the way to teenagers. There are certain adaptations of this that have been done to use in like group settings. And we've seen that in nursing homes and like group homes where maybe the social worker or teacher or activities coordinator, somebody on site that's a regular figure in those participants' lives can kind of act as that caregiver role and do some of these fun activities with the participants. This is a little bit difficult in situations where maybe a child's primary issue is not with someone that is inside the family unit, because this is very much based on that attachment and relationship building with that caregiver or other person. And so it's very difficult to maybe utilize this in situations where that caregiver or person is not in the home. Our next one we'll talk about is cognitive behavioral therapy. This is probably the one we hear about most often, both this and TFCBT, which we'll talk about next. But these are kind of, I like to think of them as your talk therapy. So some of the goals of cognitive behavioral therapy are to discover connections between your recurring thoughts, feelings, and behaviors. And cognitive behavioral therapy is used for a wide range of things. Some of the most common ones are depression, anxiety, low self-esteem, substance use disorders, trauma and PTSD, bipolar, ADHD, and chronic pain. And then cognitive behavioral therapy sessions include things like psychoeducation, and it may have the participant complete things like worksheets, and then also typically engages the client in weekly homework. And those are usually like short assignments or things to be cognizant of or to think about as you're going throughout your week, that you can kind of come back and apply when you come back the next time. This is typically a structured and short-term therapy. And like I said, it's kind of your typical talk therapy where it is very discussion heavy and a lot of explaining, talking about situations, going into the details. So some of the general information about CBT sessions typically last 30 to 60 minutes, usually weekly with homework assignments added. And this can last anywhere from 6 to 20 sessions. And this is used with ages 3 to adult. Basically, once they become verbal, all the way through elderly, it is able to be used. And then TFCBT is basically the same thing, but very much with that trauma lens added and really targeted at clients who have trauma experiences that you're trying to work through. So the goals of that TFCBT are learning skills to cope with their trauma, addressing any negative effects that the trauma is having in their life, and then overcoming troubling thoughts and behaviors. So the most common diagnosis we see for TFCBT providers are PTSD or having experiences of trauma, but maybe don't have that full PTSD diagnosis, but they're still struggling with trauma. So therapy in TFCBT looks very much like a structured therapy with a clear path forward. So there's kind of a plan outlined from the beginning of how things will proceed. However, this can be adapted or changed a little bit as you go, depending on the client's needs. This is typically done in 3 phases. So the first phase is safety and stabilization. The second phase is formal gradual exposure. And then the third phase is consolidation and integration. So breaking that down into kind of normal terms, the very first aspect is building some of those positive coping skills, maybe defining a safe space or things that feel safe to you so that you can pull from those when things do get a little bit more difficult conversation later. The second phase, that formal gradual exposure, that's basically discussing the trauma, discussing the experiences. And then that third phase, the consolidation and integration, that's bringing what you've talked about with those experiences, adding in those safety pieces, adding in those positive coping skills to be able to process through those experiences. And then another big part of TFCBT is psychoeducation. And that's really to help the client to normalize responses that their body or emotions are having, and then to help them support accurate cognitions about events. So helping them to understand, the facts of the things that occurred, but also like the way that their body is responding. These sessions typically last about an hour, ranging from 12 to 20 sessions. This is pretty much the exact same format as CBT. And TFCBT is a little bit unique because it is typically designed for children ages 3 to 18. It can also be used in adults, but is typically only seen for adult survivors of childhood trauma. EMDR is the next one we're going to talk about. And this one is kind of one of those that a lot of people hear about sometimes, but you hear weird things about it or it seems very strange. And so hopefully in talking about this one, we can nail down who this is really for and who might not be a good fit for this, and kind of explain a little bit better how this works. So the goals of EMDR are to reprocess memories and reframe the way that your brain thinks about a traumatic event. Some of the diagnoses, again, just like the CBT and TFCBT, PTSD, and then trauma. And this is going to include complex trauma. And complex trauma is basically multiple experiences of trauma over the lifespan. So that can range from things like abuse and neglect to car accidents to weather incidents to sexual or other physical violence. It's just that reoccurrence of different types of trauma on a repeated basis. So this therapy includes bilateral stimulation via tappers, light, or pin following, etc., while processing memories. So for example, one example is shoulder tapping. I know you guys can mostly see. Can you guys see me as well, or just the PowerPoint?
We can see you and the PowerPoint.
Okay, perfect. So one example, this is done a few different ways, but they'll maybe have you put your hands on your shoulders and just tap back and forth in a regular rhythm. And while you're doing that, it bilaterally stimulates both sides of your brain at the same time. So you're able to reprocess it in a way that takes the memory from a traumatic thing that happened that triggers you to simply an event that occurred in your life. So it reforms the way that you're thinking about that event. Another way is with tappers. So those little buzzers they'll put in each hand that buzz back and forth. They also do follow the pin or follow the light. We don't see that as much, but some providers do still utilize that. And so this therapy starts out with an assessment, basically talking with the client about all the different topics that they would like to cover or they feel that they need to cover. Then it moves into that work of creating a safe space, identifying your safe space. And then one of the key components of this is creating that mental safe space, similar to some like meditation activities where they might say, think about a place that feels calming to you. So maybe you think about you're walking on the beach and there's a waterfall nearby. So they walk you through creating that safe space in your mind because that's going to be a place that you're going to need to go back to as we're processing the difficult things. So these sessions typically last about an hour, and then the sessions typically last from 6 to 12 weeks, but that can be longer, again, depending on the client needs. So if they have a lot of complex trauma, multiple traumatic events that they really need to process through, it's probably going to be a little bit longer than that. And this is ages 4 to adult. So again, verbal and able to communicate their thoughts and emotions well through elderly. However, this therapy is not appropriate for everyone. It is not for patients taking certain types of medication. And this is things that if you were to call the provider, they would let you know this ahead of time if you've identified any of these things. It's also for not for those who are not yet able to handle or regulate their emotions. So this does involve some level of bringing up some really difficult things that have been experienced. And so you're intentionally going to be bringing up those thoughts and those memories. And so if a client is not able to handle that safely, then this is not going to be for them. It is also not for any client who has a high suicide or self-harm risk for the same reason. And then lastly, it's not going to be for anyone who heavily disassociates, because if we have clients that are heavily disassociating, the therapy is not going to be effective if they're not able to remember those things, but instead are just completely disassociating from it. The next one we're going to talk about is equine therapy. And after I give you a few details on this, I have a little video. That way you don't just have to listen to me the whole time. We have something a little interesting. So the goals of equine therapy are building confidence and communication and working on social skills, to improve impulse control, aggression, and anger, and then to build attachment and trust. And equine therapy can be used in a broad range of situations. So depression, anxiety, anger and aggression, PTSD or trauma experiences, medical conditions, eating disorders, conduct disorders, ADHD, and that's just a small list. It actually really can be used with just about anything. So there's two different kinds of equine therapy. So first there's hippotherapy, which is specifically riding the horse to address physical issues. So this is more often seen in those with medical conditions or physical disabilities that inhibit their, walking, moving, things like that. The second type is equine assisted therapy, which is what you hear most often, and that is for addressing mental health needs. So this therapy for the mental health needs includes horse care, such as grooming, feeding, leading horses. It also includes a high level of psychoeducation, and that's learning about behaviors, thoughts, and feelings. So horses actually mimic our feelings and emotions very closely, and so a lot of that is going to be learning to observe the horse and how they're reacting to your behavior or your thoughts and feelings. So one thing that I've recently learned about equine therapy that I think is really awesome for us to all grasp onto is that there's not really anyone disqualified from equine therapy, except for potentially someone who has very specifically harmed horses in the past. I've not necessarily heard of that. Like, that's a very specific thing. Other than that, pretty much anyone is able to participate in this. And that even includes kiddos with high levels of aggression, kiddos who are heavily dysregulated. In fact, it's actually a little specifically suited towards them because the horses have times of dysregulation. They have times of not being, completely comfortable in their environment. And so it's really, it's actually very amazing to watch the value in having a client observe how the horse is reacting and behaving and teaching them about those different emotions and then relating it back to their self. So there's just something super powerful in that. And then this is typically for ages 7 to adult. And I put about 7 because it kind of depends on the individual kid. And that would kind of be up to you to discuss with the provider, but that's about the age it typically starts. And this can be done in individual settings or in a group setting. So I hear often of like women's retreats for domestic violence victims or men's retreats, for anger management, different types of things where they do this really regularly in large group settings, but they also do it for individual therapy. There's even some providers, I don't know of any in our area or our state that do this, but that will combine both equine therapy and EMDR together and kind of use them in conjunction with each other to process those excessive traumas. And then sessions usually last from 30 minutes to an hour and are typically last between 12 to 15 sessions. Okay, so this is just a quick little video about a provider. I believe this one was in Texas, but it really, I think, kind of grasps the whole concept and puts it together. We're going to watch this real quick.
New at 6, a different approach to counseling and therapy. A local woman is using her skills as a social worker to help people work through their challenges.
But she's doing it outside a traditional office and with the help of some dear friends. 7 Action News reporter Anu Prakash with the story.
Kids and adults come here to Bridgewater Support Services for mental health services or personal growth, but it's who they're working with that seems to be breaking down walls.
I have been a horse person since I could sit up.
Amber Burkhardt Sidebottom's passion for horses inspired her to become an equestrian, and that connection kept growing.
At some point, I had started to realize what I learned from the horses and what a great opportunity that was as a kid growing up. And even as an adult, they still teach me things every day.
Amber is a licensed clinical social worker who runs Bridgewater Support Services on the same farm where she grew up in Manchester, Michigan. She uses horses to help kids and adults who are struggling with life's challenges. She has clients as young as 5, the oldest in their 20s.
I think it's a less threatening way to kind of look at ourselves.
Amber says horses pay attention to their environment. They're intuitive, and that can help open doors.
There's literally times when kids will take deep breaths. We'll say, you know, let's take a deep breath, use one of our coping skills, and the horse will do it with them. And then they're like, oh my gosh, it worked.
Craig Paxton's 2 daughters have been coming here for a year for help with their self-esteem. Emma Paxton is 10.
I wasn't making friends that well because I was too scared to talk. Some adults just don't understand what my problems are, so they just helped me calm down, and as I kept on coming here, they kept on trusting me, which helps them feel more confident.
They're both more confident. When they have problems, fears, they can bring it up here and work through it, get tips, techniques, how to deal with it when issues arise. It's done wonders.
Yvonne Dickerson says Amber and equine therapy have been life-changing for her 14-year-old daughter, Melina.
She pretty much has lots of diagnoses in her past, starting with autism on the spectrum, primarily depression, anxiety, and self-esteem.
Traditional counseling hasn't worked, but Dickerson says after 1 year of coming here, Melina is different.
She actually verbalizes how she's feeling now and recognizes that something made her mad or something made her sad, and that's a big deal. It's been a long road, and to see my daughter smile, I don't see that all the time, and this place makes her smile. I am so lucky. I love my job,
What did you do to get through
and
that
it just is the reason why I want to do this, to help, and to hear that it is helping, it just brings a tear to my eye.
Amber says it's also rewarding knowing her beloved horses, who offered her so much, are still doing the same for others.
They're all retired, and they're all potentially seen as not valuable in the horse world as far as their physical capabilities, but they have so much left to give emotionally for people, and just that they have such a great purpose just makes my heart full.
Bridgewater Support Services is open year-round. If you want to find out more about
So that kind of just gives an overview of what that experience might look like. And one of the other things that they briefly touched on, but it talks a lot about boundaries and helping kiddos to establish good boundaries. And they maintain those boundaries throughout the therapy sessions with the horses as well. Oftentimes, if a horse does not want to participate, they're not made to participate. And that doesn't necessarily mean that if a kiddo doesn't want to do something, they don't have to, but learning to appreciate other people's boundaries and then be able to build those within yourself as well is one of the big things they teach. So some of the other less common things that we see used, or therapy types that we hear about that are available, I just want to kind of talk through these in case These are something that you come upon or that you hear of a provider that is offering, just so you're kind of aware of them. So the first is cognitive processing therapy. So the goals of this are to examine trauma-based beliefs and how they can distort your perspective. This works to adjust like the client's viewpoint on life situations and their experiences. And it also teaches them how to evaluate and change upsetting thoughts that are resulting in an emotional change. This is specifically used with clients who have PTSD and trauma, and it is most often used with veterans. Therapy includes 4 phases. So the first is psychoeducation, learning about their responses, learning about the trauma, learning about the way that the brain responds. And then second, processing the trauma. Third is challenging their thoughts about the trauma. And then 4 is identifying the different trauma themes in their life and how it's affecting them currently. These sessions are typically 50 minutes for 12 weeks. And this is very specific structured program. It's not as flexible as all the other ones we've talked about. And then they have a homework assignment each week. And this can be done with individuals or in groups. And this is another form of CBT. It's just a little bit more specific. And whereas that trauma focused cognitive behavioral therapy is a specific form of CBT for children, this is more of the specific form of that CBT for trauma in adults, or adults who have not experienced that childhood trauma. This is not going to be a good therapy for those who have difficulty with literacy, because a lot of the homework is written homework. So that's a condition. Also, this is not going to be a therapy for someone who does not have PTSD or trauma symptoms. This is very specifically for that only. The next is dialectical behavioral therapy. Now, this was very specifically created or studied for those who have borderline personality disorder. And we'll talk a little bit more about that in a minute. But the goals of this is learning to accept yourself as you are, but also understanding that you have the ability to change yourself if you want to. It works to reduce the negative behaviors a person is experiencing and to increase their positive coping skills. Like I said, it was really created and geared towards borderline personality disorder, but it's also been really helpful in self-harm and suicidal behaviors, as well as eating disorders, substance disorders, depression, and anxiety. This isn't necessarily going to be one that is kind of like a general trauma-based therapy. It will address trauma within it, but this is really targeted a little bit more for those who have those specific mental health diagnoses that aren't necessarily just attributed to their trauma. So therapy in DBT will include things like focusing on identifying and exploring their thoughts and feelings. And then it starts with accepting the thoughts and feelings, and then transitions to finding ways to manage their distressing situations. So these are weekly sessions, and then some settings involve group work as well. The unique thing about this therapy is that there are phone coaching sessions in between their weekly sessions. So it is very heavily involved on a provider-client therapeutic relationship, kind of mentoring in a way, but just checking in frequently, checking on their progress, making sure they're completing their homework, and making sure you're just kind of checking in throughout the week to see how things are going. This is generally used for late adolescence into adulthood. There has been an adaptation called Dialectical Behavioral Therapy C for kids ages 6 to 12. This isn't used as frequently, and I actually don't know of any specific providers for this kind of in our metro area, but it is something that exists. Next, we're going to talk about prolonged exposure therapy. This is a little bit of a strange one for our population, but there are some situations where it could be valuable. So the goals of this is slowly expanding comfort zones to build tolerance. And these diagnoses that this is used for is typically PTSD, anxiety disorders, phobias, and OCD. So I would say that this is most commonly heard of with phobias. So let's use spiders, for example. Maybe you're absolutely deathly afraid of spiders. So maybe they will start this therapy with, let's look at a picture of a spider, and then go to, let's look at a picture of a bigger spider. And then maybe we go to a pet store and look at a spider in a cage. and it just kind of increases that, gradual experience of, that whatever that thing is, to build up your tolerance to it and reduce that fear. Now, that seems a little bit silly when it comes to things like kiddos who have experienced neglect and various traumas, because it's not safe or appropriate to go back and re-experience those things. But situations where that could make sense is maybe a child experienced trauma in a bathtub. And so maybe it's not necessarily the trauma piece or what activity occurred, and maybe they're afraid of the bathtub. And so that's kind of a situation where it could be used for our specific population. It's not as common. And typically when it's used with our population for that kind of purpose, it's integrated into some kind of other therapeutic program, and it's just used kind of on an individual basis. We kind of talked about what the therapy includes. So the details about this, it typically ranges from 8 to 15 weeks with homework in between sessions. And like I mentioned, for example, in our population, this could be used in brief spurts in the course of other therapy settings. It's generally for adults, but the prolonged exposure was adapted for use with other children and adolescents. Next, we're going to talk about some other techniques. So like prolonged exposure for our population that might just be inserted in other therapy types, that's what the rest of these do as well. It may not necessarily be that you participate in an entire course of this therapy, but maybe it's inserted in various activities that are done within the other types we've already talked about. So the first we're going to talk about is art therapy. So the goals of art therapy are to improve cognitive and sensory motor functions, and to examine the psychological and emotional undertones in art. Diagnoses this can address are trauma, depression, physical violence, domestic violence, anxiety, among many others. So this typically looks like using creative techniques like drawing, painting, putting together collages, coloring, sculpting, basically anything that you would consider an art form. And it kind of comes in 3 phases. So first, you work on focusing what is on your mind. Then you move into the phase of actually creating the art. And then lastly, you're going to work on connecting to the artwork or understanding how that artwork applies to your thoughts and emotions. These typically last about 60 minutes each for about 8 to 15 weeks. And that is if you were going to do a whole specific course of art therapy. These activities could be a few minutes long to as long as, several sessions if they're going to be incorporated into other sessions. Same with music therapy. So the goals of music therapy are gaining coping skills, learning relaxation, reducing anxieties, and improving communication. It's commonly seen used in things like pain disorders, chronic medical needs, anxiety, and depression. So things that occur in music therapy are things such as directed listening. So maybe the therapist has the client listen to a specific song or a specific audio clip, and then they kind of talk about what that audio maybe brought up for the client or what thoughts or feelings they had with that. So they use the music as a way to discuss what the person is thinking and feeling. And then rhythm work is often used for that relaxation or reducing anxieties. And rhythm work is maybe there's a particular rhythm that they work on, they do a particular drumming pattern or a particular scribbling pattern, something like that, that just creates that rhythm of sound. And then they utilize that as kind of that safe space or, that calming effect when discussing other hard topics. So these are typically 30 to 60 minutes and can last from weeks to months. And again, this is done individual or group and can be incorporated into other therapies. And for both art therapy and music therapy, there's no really restriction on who should participate in these or who shouldn't. And it is fully available to all ages. Next is somatic therapy. So this really focuses on that mind-body connection. So specifically how a client's physical sensations indicate where their traumatic memories are stored in the body. So that means maybe we're talking about a difficult subject and the therapist may say something like, are you feeling any tension in your body right now? If so, where do you feel that at? And really, that's kind of how it's incorporated into other types of therapy. Let's, take brief moments to explore what your body is feeling and how that's connected to the emotion that you're experiencing. It typically uses purposeful attention to movement and mind-body exercises. And this can have things like breath work, meditation, and guided imagery. Next is polyvagal therapy. The goals of this are to educate the client about their nervous system and the typical ways that a nervous system responds to different events. And they do this while helping the client to recognize their reactions to the initial trauma and how those are presenting in present day triggers. And they also teach strategies that you can use when those triggers occur. We often, those last two, the somatic therapy and the polyvagal therapy, we don't often hear them called that. Those are typically just things that are done in other sessions. So we don't often hear those names. And then the next one is narrative exposure therapy. So this, the goals for this are to identify how traumas have in the past and are currently impacting their life, and then to help them reclaim their identity and control of their story. So this looks like, a therapist supporting the client and writing out their life story, from start to finish, including all of the traumatic events, but also, positive things that have happened. And then as they go through and read and share what they have written, the therapist really helps them to pay very specific attention to their thoughts and emotions, as well as those physical sensations as they're reading through each part of their story. This is typically short term. It's usually done in, 1 to a few sessions. And then this is very typically used or most commonly used for survivors of complex trauma. And then group therapy, this is not a specific therapy modality, but it's something I think a lot of people wonder, like, should I, choose individual therapy? Should I choose group therapy? So I wanted to briefly talk about it. The goals of group therapy are really to connect with others of similar life experiences and those who understand you on some level. This typically looks like open conversation, story sharing, gentle challenges, exchange of coping strategies. And these group therapy sessions are led by certified therapists. They help guide discussions. Goodness, I can't talk today. Build community and address issues that may come up during the course of the group. And this is where it's different than like a support group. So a support group could potentially be led by a peer or really just about anyone, whereas a group therapy session is going to be led by a certified therapist that kind of has some goals in mind. A group therapy length kind of varies. It averages about 8 to 10 weeks at about 45 to 90 minutes per session. But some of these groups are kind of ongoing with content that just restarts every 8 to 10 weeks. So maybe you want to attend for 20 weeks. You would kind of go through that whole curriculum twice. And diagnosis, there's not anything specific that goes to this, but some really common things that we see. So trauma, a variety of different mental health conditions, a variety of medical conditions, and then also survivor groups. So maybe that's survivors of different traumatic events, survivors of childhood trauma. It really can be just about anything that can attend group therapy. So how do we choose the right option? So I think the very first thing to consider is, what is it that you are trying to accomplish in therapy? Are you just trying to find a safe space for yourself or your child to share their experiences or to process things that are happening? Or is it a little bit more intense and you're needing help with some behavioral modification, or you're needing help with improving that attachment? So I think really evaluating within yourself and your family, what is it that I'm trying to get out of therapy? Not just, I need a therapist because therapy is great for everyone. That's fantastic. But if you're looking at one of these treatment modalities, what is it that I'm trying to accomplish? And I'm going to, I know we talked about this, most lunch and learns, if not all of them, but I want to come back to this, the concept of adoption competency. So the 7 key concepts of adoption competency: the loss, rejection, guilt and shame, grief, identity, intimacy, mastery, and control. There are many, many excellent therapists out there doing incredible work. But we always recommend, if you can find one who is adoption competent, has some sort of training or experience with foster and adoptive families, that understands how all of these 7 key concepts work together and work together in the concept or, situation of someone who has experienced trauma, that is always going to be a better fit, because they have the whole picture and are not just addressing an aggressive behavior, but they're addressing all of these potential root causes and how all of that really plays together. And I'll end with, it is okay to ask questions. Just because you call a provider and they have an available spot, it is okay to ask them about their training. It's okay to ask them about what experience they have serving your particular population of client. It's really okay to ask those questions to find something that you feel is the best fit for you and your family. So that's all we have for today. So do we have any questions for our last few minutes? Check her chat here.
I just wanted to ask a quick question.
Yeah, go for it.
I really enjoyed this today, and it really has helped me to kind of see maybe some different possibilities that will assist my children. I really love the idea of kind of going through their life book, if you will, and kind of I think that will help to establish some closure. And then the art, music, and equine therapy, I think, is just a really interactive way for them to, express themselves and make peace with themselves as well. So I really appreciated that. I wanted to see if I email you, would it be possible to get a copy of your slides?
Yeah, absolutely. Yeah, that's not
Okay.
a problem at all.
Great. Thank you.
Yeah, absolutely. And I think you mentioned a really great point. Some of these, like the art, the music, the equine, are really good for kiddos that may not be ready to talk in detail about their experiences. And really, even EMDR to a certain level, it's not like traditional talk therapy where you sit and, delve into every detail of the thing that happened. It's just more awareness of, this is a thing that happened. This is how I feel about it, that kind of thing. But those are all really great options for, kiddos or families who maybe don't even know what their emotions are or know what's bothering them. But they can just kind of process things in their own way without having to find the perfect words for it. So I love that.
Thank you. Thanks for helping me to address that today.
Yeah, not a problem. And then if anybody else would like the slides, feel free. If you want to email me or just drop your name in the chat and I can get it sent to you.